Almost everyone gets Medicare wrong on the first try, and it's not because people aren't intelligent, it's because no one's actually shown them how the whole thing actually fits together. They're given pieces of information and left to figure out the rest on their own. So in this video, in the next 9 minutes, I'm going to go over how this all works together, show you the map of how Medicare works, the paths that you can take with Medicare in plain English. So by the end of this video, you'll know more about Medicare than 90% of the people that are out there. So let's walk through it. Hi, I'm Joseph Pate, better known as Medicare Joe, and we've helped thousands of folks enroll successfully into Medicare. In this video, I'm going to go over those 3 things that you need to know, the 4 parts of Medicare, the 2 pathways that you actually have when getting onto Medicare, and the 1 decision that will ultimately decide everything else for you. Here's the pain point. Most people think that you have 100 different Medicare options that are out there, and that's not true. They start by comparing plans and comparing what their friends have, and that's really step 3 in the whole process. So if you don't understand steps 1 and step 2 before you get to step 3, which is comparing plans, you're just guessing what option is going to be best for you. I do this every day, and I have this conversation every day with people. Someone will call in and say, my neighbor has a plan G, or my neighbor has a plan N, should I get that one? Or this commercial is talking about Medicare Advantage that has dental, should I take that one? And both of those questions are great questions, but they're just in the wrong order, because we need to know, before we can answer that, you have to answer which road of Medicare do you actually want to be on. And before you answer which road of Medicare you want to be on, you need to understand the parts of Medicare and how they work. And if nobody's actually walked you through that, let's do it now so you can see how ultimately that will work. So with Medicare, the crazy part is you have 4 parts. You have Part A, Part B, Part C, and Part D. And although they all have something to do with Medicare, they don't actually all work together with your plan when on Medicare. You can have some of these parts, but not all of the parts together. So I like to call it the 2 roads and 2 different ways you can go with Medicare. And you don't actually choose, do I want Part A, do I want Part B, do I want Part C or Part D? You're always gonna get Part A and Part B when you get onto Medicare, but then you're gonna choose which road you wanna go down after that. And if you're not making that decision first, it's gonna be impossible to compare plans correctly for how you want your Medicare to work. We're putting the cart before the horse in that case. So the problem is that the 4 parts of Medicare can really get confusing for people. So I'm going to run through a quick breakdown on what each part actually does and is, just so we have a good foundation of knowledge. So Part A is your hospital coverage. This is if you are inpatient at a hospital stay, skilled nursing facility. Most people pay nothing for Part A as long as you've worked 40 quarters or your spouse has worked 40 quarters. That's going to be free to you when you get onto Medicare. That is your hospital coverage. Now Part B is your medical coverage. So everything outside the hospital, let's call it, doctor visits, outpatient surgeries, lab work. Now this one here does have a premium associated with it. You're going to pay a Part B monthly premium. It will come out of your Social Security if you are already receiving a Social Security check. Now Part B, because that's the one that you're going to pay for, there's another video we'll talk about costs and what that can look like, because that Part B premium will change yearly based on what Medicare set to that. Now Part C is really a separate part of Medicare. And I say that because this is one of those roads that you can go down. So Part C is a way to group Part A and Part B together, but ultimately you're insured by a private insurance company. So on Part C, Medicare Advantage, a private insurance company is handling the hospital, the doctor, the medications, everything within one managed care organization, and they call it Part C. So you have to have Part A and Part B to get Part C, but you don't have Part A, Part B, and C working together. You ultimately are giving up how A and B work to be insured by Part C, but you need to have Part A and B to be able to get Part C. I know that can be confusing. That's how that works. And then Part D is going to be your prescription drug coverage. So on original Medicare, Part A and Part B, that doesn't cover you for medications. So Part D is its own separate standalone plan, which you'd have through a private insurance company to cover your medications, pay co-pays on medications based on whatever you're taking for that calendar year. So that's the 4 parts of Medicare. But before we move on, I want everyone to stop thinking of Part A, Part B, Part C, and D as a menu, right? We need to think that Part A and Part B is what we're gonna have no matter what when we get onto Medicare. That is the ultimate foundation. Part D handles your drugs, if we need to go that route. And C is a way to ultimately package all of our Medicare together in one plan. So the real question that you need to answer first is, what parts do I actually want? And that's the next thing. Because here's the one thing that nobody actually says out loud. You don't have 100 Medicare choices to pick from. You really only have one. And once you make that one decision, everything else is going to fall into place very simply for you. And again, I come back to the two roads. So let me show you how the two roads work, because this is the single most decision that you need to be able to make when getting onto Medicare. There's only two ways Medicare can work. So road one would be original Medicare. So you'd have Part A, Part B. That would be your primary insurance. You would have a supplement plan that supplements your original Medicare. And then you would have a Part D drug plan that covers your drugs. So you'd have A, B, a supplement, and D. In this option here, the trade-off is you're gonna pay a monthly premium for the supplement plan, and in return, you're gonna basically see any doctor or hospital you want in the country that accepts Medicare, and you're gonna have very minimal out-of-pocket costs when using the plan. So think of this as a premium paying per month option with very low out-of-pocket costs. Flexibility to see any doctor or hospital you want. Road two, option two here. So while you have A and B, instead of layering that with a supplement plan on top, you're basically going to say, I'm eligible for A and B, but I'm gonna hand that in, and I'm gonna choose a Part C Medicare Advantage plan to replace my A and B and ultimately package my healthcare into one private insurance company. Very similar to how you have been insured through an employer or private healthcare in the past. So the way that this works is the only thing you're going to pay for really is your Part B premium. There's no additional cost that you pay per month in a premium when you're on Part C. But how you pay is you're going to pay when you use the plan. So that's the trade-off. You generally have to use a network of doctors that accept the plan, and you're going to pay copays for, specialists, emergency room visits, hospitalization, surgeries, really anything you can think of while you're using the plan. You're going to have some type of copay that you have to pay for on a Medicare Advantage plan. So very low premium option, but we're gonna pay as we use it. So if we're healthy and we don't use it, great. But if we get ill and we start using it a lot, it can get pretty costly, almost to the point, a lot of cases where it's 2 to 3 times more than if we were on just original Medicare with a supplement plan. And that's it. Road one, which is original Medicare with a supplement plan, or road two, which is Medicare Advantage. Every conversation you've ever heard, Plan G versus Plan N, Advantage versus Supplement, PPO versus HMOs. Those are all sub-questions within how you want your plan to work at this split in the road. You don't pick a plan first, you pick a road first. And I have included a link below to our two roads worksheet that ultimately outlines how that can work for you. And we start everybody off with the two roads worksheet, because that's the single decision you need to make first before we start talking doctors and plan benefits and all that stuff. We need to know how we want our plan to work, because here's the honest part. There's no universal right answer between road one and road two. It's not a one size fits all. But there is a right answer for you and how you want your healthcare to work. It depends on your health, depends on your doctors, your prescriptions, heck, your budget, how much predictability you want within the plan, how much freedom you want within the plan. And anyone who tells you that one road is better than the other isn't giving you advice, they're just giving you their inventory basically as an agent. I mean, the right road is the one that fits your needs best, not someone else's commission. Remember that. It's not a one-size-fits-all option at the end of the day. So if you know anybody who's about to start Medicare, or if you're getting onto Medicare and you're confused by this stuff, feel free to share this video to them, like this video, subscribe to our channel. Everyone deserves to see the full map before they actually start picking plans at the end of the day. And if you are getting onto Medicare here or have questions, my team would be happy to walk you through a free consultation, understand your situation, understand your needs, and walk you through what road might be best fit for you. So you can book that with the link below. And again, if you'd like to be updated when we post new YouTube videos to our channel here, hit that subscribe button. It'll send you a notification every time we post a new video. Other than that, I'm Medicare Joe, and again, thanks for watching.